Concerns have been raised for months about racial disparities in the push to vaccinate Americans against the coronavirus. CDC numbers from last week show nearly 2/3 of those who have been vaccinated are white. 12% are Hispanic, 9% are Black. Asian Americans accounted for 6%. American Indians and Alaskan Natives combined accounted for fewer than 1%. An op-ed published in the New York Times touches on the impact America's racist history is having on vaccinations. Racism makes me question everything. I got the vaccine anyway. Dives into why many Black Americans hold mistrust in the healthcare system and why choosing to get vaccinated is a personal negotiation. Joining me now for more is the author of that article, Damon Young. Damon is a contributing opinion writer for the New York Times. He is also the author of What Doesn't Kill You Makes You Blacker, a memoir in essays. Damon, welcome. Great to have you with us. So you point out in your article the many stories of racism over the years that were later found to be untrue, but the lasting impression they made, you say, was still justified. How is this history of racism affecting the way you personally approach the pandemic?
Well, you have to, realize that there are justified reasons for a deep institutional skepticism that many Black Americans and other people of color have, in regards to America. And yes, in the article I wrote, in the essay I wrote for the Times, I pointed out some of the false conspiracies that I believed when I was in college and a bit younger than that. But there are also very real conspiracies, things that literally happened too. I mean, COINTELPRO is a thing that literally happened. The Tuskegee experiment, redlining, gerrymandering has this racist intents and backgrounds too. So when you think of some of the falsehoods and how they mix up with the things that have actually happened, what happens is it creates this general sense of skepticism for America and for American institutions. And the institution of medicine is not immune to that. In fact, it's probably the institution that we have the most justified skepticism for.
Right. And how do you feel now that you have received your second dose of the vaccine? Do you feel that was worth it? Was your personal negotiation over the vaccination worth it in the end?
Oh, definitely. Definitely. I've been a person who took COVID seriously from day one. In March, I was traveling, I was doing bulk stuff still, and I got off the road. I've been home for a year, hunkered down. And so I do feel, I guess, a bit less anxiety about the coronavirus since I've been vaccinated, and my wife has been vaccinated too. And I also want to make clear that the conspiracies and the skepticism, that is not necessarily what accounts for the lack of so many of us getting the vaccines. You have to also look at some of the structural things that are in place, some of the accessibility factors too, that are in place too, where some of us just don't have the same access to getting the vaccines that other people in other communities do. So it's not just about Black people, have like this pathological mistrust of the government. There are also barriers in place that prevent us from doing a lot of the same things that help keep us healthy, that white people are able to do.
Sure. And, we here at CBSN have been sort of covering the coronavirus and the vaccination efforts for a long time. And for a while, there were many people saying, look, this narrative that the African-American community is afraid of getting vaccinated is overshadowing the more important one, which is that the people that want to get it can't get it because the infrastructure isn't there. So did you worry at all that also that could happen, that you have people talking about, well, there's vaccine hesitancy, but really the real conversation should be over getting it to people, the people that want it and the people that need it?
Oh, definitely, because that's the main issue. The main issue isn't necessarily about skepticism or about justified cynicism. It's about access. It's about equality. It's about equity. And again, because those things haven't existed, and the vaccine is just one is just one place. You just go down the line of institutions in America that have, been harder for us to access. I mean, there's even this national conversation about voting, and people on one end of the spectrum trying to make voting more difficult for us. And again, it's more about access than it is about skepticism. But skepticism is real. And it's real, but it's also justified because there are historical justifications and also present day justifications for it.
Absolutely. And, I think that one of the things the COVID-19 pandemic showed us, or just laid bare for everyone to see, is how inequitable the healthcare system is. I mean, as you know, Black and brown communities were hit the hardest. So do you believe that this experience will force the U.S. to reconstruct its healthcare system in a way that's more equitable?
I mean, do I believe it would happen? It's going to happen? No. Do I hope it happens? Sure. But do I have faith in it happening? I have more faith in the things that I could see and that I could touch, like this lamp that's next to my laptop. But in terms of, America changing in a better way, is so that these sorts of things become more accessible and become more equitable. I just do not have that faith. And I'm not saying it's not possible. I'm just saying that, I live in Pennsylvania, but I'm from Missouri, the show me state.
And Damon, you did know that Kizzmekia Cormett, a African-American female scientist, had a key role in developing the coronavirus vaccine, which is amazing. And I wonder, did that help on any level in terms of trust?
That didn't. Not for me personally. There might be some people, some Black people out there where that actually made a difference. But the thing is, and this I guess gets to the larger point, is despite this skepticism, despite the cynicism, whatever, and again, it's justified with medicine, it's justified with government, we actually are more engaged. If you look statistically, we're actually more engaged. Politically, we're more likely to we're more likely to want to get the vaccine than in fact, the population, the demographic that I guess is least likely to want to get the vaccine is white evangelicals. And so despite all of this skepticism, despite all the cynicism, we still show up, and we still, quote unquote, take one for the team. And that has been a thing that has been a recurring thing throughout our history here.
Well, Damon Young, thank you so much for joining us. We appreciate your perspective and your time.
Oh, thanks for having me. Thank you.